management of acute panic attack is benzodiazepine, but in panic disorder it is SSRI. Depersonalization versus trance disorder. So trance is actually temporary. The personality is not changed to another one, but in depersonalization it's changed to another personality. Bluer 4A's are ambivalence, autism, affect disturbance, and association disturbance. Tourette syndrome 1 year criteria, of which 6 months. There should be both the vocal tics and motor tics. Posturing versus waxy flexibility. Posturing is actually it is active. Waxy flexibility somebody is doing. In a wax you can mold. Passive. Excoriation disorder versus Magnan symptoms. Excoriation disorder is hoarding disorder. Magnan symptoms means it is actually excoriation is a type of OCD, that is skin picking. Magnan symptom, it is chronic cocaine poisoning. Depression versus dysthymia. Depression, the 2 weeks enough for criteria. When major depressive, then again 2 years, but more than 2 years dysthymia. The word change. Relative risk versus attributable risk. When you say relative risk, you say for example 80%. So 80% chance of getting lung cancer, but attributable you are coming back. Like 80% of this lung cancer is because of smoking. Regression coefficient, coefficient of correlation. Coefficient of correlation, we are drawing a graph. It can have slope upwards, downwards, +1, -1, 0. Whereas regression coefficient is y is equal to a plus bx. Life expectancy is actually mortality indicator. Mortality, most of them they are into 1000, and 2 of them into 100, that is case fatality and proportional mortality rate. Into 100,000, that is maternal mortality ratio. The next morbidity, this DALI, all those are morbidity indicators. Life expectancy is mortality indicator. Anterior to transverse pericardial sinus, it is aorta. Pope sign is proximal tendon rupture. The question I have forgotten to fill that, which nerve do not pass through diaphragmatic opening, that is left phrenic. Hope you remember right phrenic through inferior vena cava. So left phrenic, that it's not going through this specific opening, whereas right and left vagus both are going to same esophagus opening. So with nerve that can injure in submandibular gland, when you're putting incision, marginal mandibular excision, that is lingual nerve. SVE, you have to remember, do not write 8. So that means 9, 10, 11, which is dorsal nucleus of vagus. So remember, do not include 8 and 6, so it will include 5, 6 not there, so 7, 8 not there, so 9, and 10, which is nucleus ambiguous. Then next, bulbourethral is another name for Cowper's in deep perineal pouch. Bartholin's is in superficial perineal pouch. Arcuate line is actually located midway between umbilicus and pubic symphysis. Above that, the rectus muscles, they are resting in behind. You are having the posterior layer of internal oblique and transverse abdominis, whereas below that it is resting just on fascia transversalis. All the muscles are running in front of these rectus muscles. Then superficial circumflex iliac artery, it is a branch of and deep circumflex iliac. So that can be confusion. Superficial circumflex iliac is from femoral, whereas deep is internal iliac. Knee locking and unlocking. Locking vastus medialis, so it is in medial rotation and it is in extension. Unlocking flexion, popliteus lateral rotation. Bronchial vein draining into either azygous right side, left side hemiazygous. Narrowest part of ureter is vesico-ureteric junction. Osteosarcoma, mainly you have radio resistant chemotherapy you are giving. Okay, radio resistant tumor. Giant cell tumor main management is mainly you have to cure it and put graft. Garden stage classification, you have to remember all three are out of order in type 3. Lachman versus anterior drawer test. You have to look for the position of the hand where they have kept both are in front of the knee or one on the one hand to the foot. Then next is bone holding, forceps and bone nibbler. Bone holding, it's on the sideways, asymmetrical looking, both blades. Vertical, that is bone nibbler. Curling ulcer in fundus. Seward classification, remember type 1, 2 and 3. So type 1 means type 2 is 1 above 1 below OG junction. Type 1 5 cm above that, 5 cm below that lowest point, that is 3. Forest is for bleeding, Rocard is rebleeding. Gold standard test for diagnosis of insulinoma, you are doing 72 hours of fasting, still insulin level is high. Nerve supply from lumbar plexus, you have to remember the scrotum or labia majora, that is cremasteric nerve, whereas above the root of penis and or ilioinguinal and the suprapubic iliohypogastric nerve and the medial thigh femoral nerve. Achalasia cardia develops into squamous cell cancer. Meckel's diverticulum, you can do conservative management if it is thin and wide neck. Otherwise resection. Fast areas are, one is the tooth, right and left subhepatic. You are doing the pericardial effusion, subxiphoid and pelvic. So 4 plus 2 in E fast, that is thoracic cavity for pleural effusion, right and left. So in small bowel tumor, the investigation of choice is enteroclysis. Beta histine is what? It is agonist for H3 and H1 it is agonist, but main action is H3. It is having antagonist action, H3 blocker, but H1 agonist, H1 agonist. Histine you are writing H1 agonist, H3 blocking. A carbo is less likely to cause hypoglycemia. ALOH3 cause constipation, MgOH2 cause diarrhea. Digoxin and lithium are liver friendly. Dilamanid action is mycolic acid synthesis inhibitor. Dilamanid, isoniazid, like that. Okay. Dopamine dose effect, you remember USWA, U for initial urine output increase, then stimulant, less than 2 to 10, more than 10, it will be causing vasoconstriction. Polymyxin cholestyrin against the gram negative. Pitolisant is H3 inverse agonist. Normal shock index 0.5 to 0.7. Okay, you can terminate at 34 weeks if PSP more than 1.5. Headache with autonomic symptoms responding to indomethacin, then it is paroxysmal hemicrania. pH more than 5.5, type 3 RTA. Phlebotomy will not resolve arthropathy in hemochromatosis. So in HOCM there is posteriorly directed jet of flow. So after an MI, there can be some ventricular escape rhythm that is called, it can be accelerated idioventricular rhythm. Accelerated, then the rate is 60 to 100. Short-term preservation for cornea, that is Macquarie-Kaufman. In short form, you can say MK. Short-term, short form. Which scan is used for UJ obstruction? It is MAC3 scan. And stage in Birad's stage 3, it is actually benign, less than 2% chance only, but you have to do short follow-up. Stage 3 Birad's is probably benign, that's why it is short follow-up, and probably that is less than 2% chance of malignancy is still there. Okay, so stay tuned till then. Bye.